There are people who may have heard vaguely about this report into surgeries at Cappagh Hospital and at Temple Street Hospital. But what's the full context?
So this is an audit into paediatric hip surgeries carried out, as you say, in 3 Dublin hospitals. So 2 CHI managed hospitals, Temple Street Hospital and Crumlin Hospital, and the National Orthopaedic Hospital at Cappagh. The audit was prompted by a number of whistleblowers who raised concerns in relation to the necessity for these hip surgeries to be carried out. So that is the background to the audit. We understand it started in July of last year, and an unpublished or unfinished audit report has been leaked. And unfortunately, it makes for stark reading. Well, it appears that it's outlined in the report that 60% of the hip surgeries undertaken in Temple Street Hospital didn't meet the clinical threshold that is necessary for these surgeries to be performed. And in Cappagh Hospital, 79% of the hip surgeries didn't meet the thresholds either. Now, the results were considerably better in Crumlin Hospital, where 98% of the surgeries performed met the threshold, met the clinical threshold, so it was appropriate for them to take place. So it makes for stark reading. Obviously, we haven't actually seen the report as of yet, but it certainly raises a lot of concerns.
So, if we take a step back, Lucy, what symptoms might a child have presented with to warrant assessment in the first place?
Well, I suppose we're talking here about hip surgeries to correct hip dysplasia. So in layman's terms, we're talking about the ball and socket joint not having developed properly. So we're talking about symptoms of pain. In older children, perhaps their walk wouldn't be as one would expect for their age. And in order to correct it, there's a surgery performed, which is a very invasive surgery. It involves general anesthetic, it involves the bone being pared, and it involves screws being implanted to connect if you like, the ball to the socket. So this is a very invasive surgery, and not a surgery that would be undertaken lightly by parents, but for them understanding that this is a necessity and something that will improve their infant and child's standard of living.
And naturally, parents will trust the medical advice that they're getting. But what would have been a more appropriate intervention for children who didn't meet that full criteria for surgery?
Well, we understand that this is a condition that if in some cases, if it's left alone, it can correct itself. And what's concerning is that if there are children who are deemed now, according to the audit, not to have met the clinical standards, that tells me certainly that these children didn't require this surgery. Now, perhaps it's a situation where they may have required it down the line, but they certainly didn't require it according to this draft report at the time it was carried out.
So, based on what we know so far, and okay, the full report has yet to be published, but if we assume a situation where a child underwent surgery and it wasn't completely necessary, or at least necessary at that time, then they will have at least incurred stress that would have been the exposure to risk that was perhaps unnecessary. So how would you construct a legal case?
Well, I mean, there's risks obviously associated with every procedure. So they would have been exposed, as you say, to all of those risks unnecessarily. There's a very significant issue here in relation to the consent that their parents provided. Before any procedure, a patient is asked to sign an informed consent form, and that's whereby they're informed of the risks and the alternatives to the surgery that they're going to undertake. and they're happy to proceed with the surgery despite the risks that they're being informed of. But here, obviously, parents weren't adequately consented because they are obviously being told that this is a necessary surgery, your child requires this surgery, and this will improve their life. However, it appears from this report that that was not the case for a lot of children. So parents weren't adequately consented, and that's very concerning. But going back to your question, so we have the consent issue, but we also have undergoing an unnecessary procedure under general anaesthetic for an infant or a child. And naturally, the future consequences, this will not be the only surgery that these children will require on their hips. So that will need to be looked at on a case-by-case basis in terms of their future and what requirements they need going forward.
And the risks of taking a case, as we mentioned earlier, it could be argued that the surgery was warranted later in life, perhaps, rather than at that immediate time. So could there be a problem proving damages?
Well, I think here the main thing to assert is that for any parent who has, received a letter advising them of this audit, that it's taking place and inviting them to an appointment, the main thing is to ascertain whether or not their child required this surgery at the time that they had it. Okay. And again, I understand that the report makes a recommendation that there will be an independent clinical assessment provided to these children, and that's hugely important because it needs to be ascertained first and foremost if a child required this surgery at the time that they underwent the surgery. I mean, that's crucial, and that's crucial in as you say, establishing negligence. But I think parents have been through so much already. I think there's an obligation on the state to be entirely transparent once this report is completed and published. The state needs to be entirely transparent with patients and their families, and hold their hands up and say, well, look, we got it wrong in this situation, and put a plan in place to look after these families. And I'm not only just talking about the children, but also the parents. I mean, this is a terrible position for any parent to find themselves in, to be faced with the prospect that they consented, or apparently consented, to a surgery that was not ultimately required.
Lucy Boyle, appreciate your time this morning. Thank you.
Thanks, Will.
Lucy is a solicitor specialising in medical negligence with Tormey's Solicitors in Athlone.